This presentation is titled Investigating Older Adults' Attitudes Towards Crisis Informatics Tools, an opportunity for enhancing community resilience during disasters. To begin, the world is getting older. But how much older? In 2050, less than 30 years from now, the number of adults 65 years and above in the United States will be triple than in 2010. With the growth in the number of older adults, we can project that technology use among them will continue to grow as well. At the same time, issues related to climate change, such as natural disasters, are becoming more frequent and severe, reminding us on how can we use technology to support our aging population in times of disasters or crisis. These include utilizing information and communication technologies such as crisis apps and social media in mitigating the effects of crisis. This body of work is also known as crisis informatics, an interdisciplinary research area that investigates the interconnectedness of people, organizations, and information technology during crisis. However, while many crisis informatics tools have focused overwhelmingly on general population, very few considered subpopulation group, for example, older adults. While there are many works focusing on older adults during disasters, there are still gaps need to be further explored. First, a lot of studies have focused on older adults who live in institutions, which obscure the attention to their independent abilities and experience. Second, much too often, older adults are seen as passive victims to their own stories, which again limit our knowledge in their concerns and priorities when making decisions. Third, the use of technology among older adults lack the context of disaster. This is potentially due to the slow growth of technology among older adults, which then condense the efforts to develop the tools that support them. Our study seeks to fill in these gaps. In this study, we focus on enhancing community resilience among older adults. While the exact definition of community resilience continues to be debated in literatures, previous works agree that community resilience consists of 4 important elements: local knowledge, preparedness, community relationships, and communications. In this study, we define community resilience, similar with Andrew, as communities and individuals harnessing local resources and expertise to help themselves during emergency. Our study is guided by 2 research questions. First, what are older adults' attitudes towards emergencies and towards community support during emergencies? And second, what are older adults' preferences for and attitudes towards crisis informatics tools that facilitate community support in emergencies? To answer these questions, we conducted a focus group sessions with 18 older adults living in coastal towns in the northeast of the United States. In this study, our participants must be 65 years and above, had past experience with emergencies, and use technology devices daily. Our session begins with a semi-structured focus group discussion, followed by a storyboard activity, and end with a survey assessment. In the focus group discussion, participants were asked about the unique challenges living in coastal regions, as well as their perceptions about the reliability of local community resources in providing assistance during emergencies. Participants were then asked to complete a storyboard to explore their attitudes towards and preferences for crisis app features that enhance community support. In the last part of the study, participants filled a survey. Other than demographic information, participants answered a series of questions related to sense of control, social relationships, and digital readiness. Data collected from the discussions and survey allow us to perform a triangulation study in understanding how participants' choices and preferences for tools on crisis apps relate to their sense of control, social relationships, and digital readiness. From the analysis, we found that the themes emerged are related to the elements of community resilience. Our analysis from the survey data showed how our participants have high personal mastery and low perceived constraints, which reflected a high sense of control. They also reported to have been in frequent contact with their families and friends. And as for digital readiness, our participants reported feeling productive and confident in using technology, which aligns with their daily technology usage. From the group discussions, our analysis presents several emerging themes. First, in addressing situated vulnerability and awareness, we found that participants were informed on their vulnerability not from physical aspects, but from the risk of living in coastal locations. Therefore, they focus on tools that are up-to-date and sensitive to weather and emergency notification. Such informedness of their situated vulnerability provided a sense of awareness that influenced them to make personal preparations which relates to their sense of control. This theme is aligned with two aspects of community resilience, which are preparedness and knowledge. Second, while crisis informatics tools for older adults can enhance their active community role through the ability of forming and joining small groups, our participants stated how active participation can include informing their communities about upcoming emergencies, as well as providing means and methods to save lives, which supported the elements of community relationships. Third, our findings found that participants prefer to get help and support from emergency responders than familial connections as found in other studies. Recall that earlier, we saw that they are well connected with their family and friends, but during emergency, we highly preferred the support of emergency responders. These may stem from them exercising their control or through effective communication from the local responders. Fourth, in describing the trust and agency of crisis apps, our participants described information they are willing to submit to get support from emergency responders, which include detailed information such as medical and medication needs. To the best of our knowledge, this finding is relatively new in the studies of crisis informatics, but the trade-off that participants had to make to get support and services from have never been discussed before. More importantly, we also describe how submitting personal information does not mean they are willing to subscribe to any crisis apps, so transparency of how their information is being utilized are demanded. In summary, we describe the crisis app features that relates to the needs and priorities of older adults as well as the elements in community resilience. We also describe opportunities and challenges for crisis informatics tools, which include leveraging influential older adults to advocate towards crisis apps enrollment. We also propose towards utilizing information that are provided and not that are needed when designing models and methods to deploy our emergency services for older adults. Thank you.